This is care of the patient with a neurologic disorder. So this video is going to cover the beginning of anatomy and physiology, and then also the diagnostic test. So the nervous system has two main structural divisions, the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and spinal cord. It is responsible for interpreting incoming sensory information and issuing instructions based on past experiences. Your peripheral nervous system, this includes all the nerves that lie outside the CNS. So it has two main divisions, the somatic nervous system and the autonomic nervous system. So in the somatic nervous system, it sends messages to the CNS via sensory neurons, and from the CNS to the skeletal muscles via motor neurons. In the autonomic system, it transmits messages from the CNS to the smooth muscle, cardiac muscle, and certain glands. The autonomic system is sometimes called the involuntary nervous system because its actions take place without conscious control. And within the autonomic system, it has two divisions, which is the sympathetic and parasympathetic. So cells of the nervous system, you have your neuron, which is the basic cell of the nervous system. It has a separate unit composed of three main structures, the cell body, the axon, and the dendrites. So the axon is the cylindric extension of a nerve cell that conducts impulses away from the neuron cell body. Your dendrites are branching structures that extend from the cell body and receive impulses. Then between each neuron is a gap called the synapse, and it's defined as the region surrounding the point of contact between two neurons or between a neuron and an effector organ, and across which nerve impulses are transmitted through the action of a neurotransmitter. So the body's nervous system connects with the muscular system via the neuromuscular junction, and neurotransmitters act to make certain that the neurologic impulse passes from the nerves to the muscles. So your neurotransmitters, these are numerous chemicals. They modify or result in the transmission of impulses between synapses and at the neuromuscular junction. So you have four main ones: acetylcholine, norepinephrine, dopamine, and serotonin. So for acetylcholine, this plays a role in nerve impulse transmission. It spills into the synapse area and speeds the transmission of impulses. It also contains the enzyme cholinesterase. This is released to deactivate the acetylcholine once the message or impulse has been sent, and this happens rapidly and continuously as each impulse is relayed. Then you have norepinephrine. It has an effect on maintaining arousal, so it helps to wake you up, dreaming, and regulation of mood. You have dopamine, which primarily affects motor functions. It is involved in the gross subconscious movements of the skeletal muscles, and it also plays a role in emotional responses. Then you have serotonin. This induces sleep. It affects sensory perception, it controls temperature, and it also plays a role in the control of mood. So your neuron coverings, many neuron fibers, axons, and dendrites are covered with a white, waxy, fatty material called your myelin. So the myelin increases the rate of transmission of impulses, and it protects and insulates the fibers. Axons leaving the CNS are wrapped in layers of myelin with indentations called the nodes of Ranvier. And these nodes further increase the rate of transmission because the impulse can jump from node to node. In the peripheral nervous system, the myelin is produced by Schwann cells. The outer membrane of the Schwann cell gives rise to another layer called the neurolema. And the neurolema is important because it helps regenerate injured axons. Thus, regeneration of nervous cells occurs only in the peripheral nervous system. Cells damaged in the CNS result in permanent damage or paralysis because they do not have neurolema and are not able to regenerate. So again, your neurolema, they help to regenerate axons. They're found in the Peripheral nervous system. So this is where regeneration occurs. It cannot occur in the CNS. So let's start talking about the CNS, which we said before is the brain and spinal cord. So your brain, it is divided into 4 principal parts. You have the cerebrum, the diencephalon, the cerebellum, and the brainstem. So in your cerebrum, it is the largest part of the brain. It is divided into left and right hemispheres. You have the outer portion of the cerebrum is composed of gray matter that has caused the cerebral cortex. The cerebrum contains the 4 lobes, which are frontal, parietal, temporal, and occipital. In Broca's area, you have that's found in the frontal lobe, and then your Wernicke's area is the temporal lobe. So I'll just zoom in so you can kind of see that picture there. You have your parietal, frontal, occipital, and temporal lobes. Next is the diencephalon. This is often called the interbrain. It contains the thalamus and the hypothalamus, and we know the thalamus serves as a relay station on the way to the cerebral cortex for some sensory impulses. It interprets other sensory messages such as pain, light, touch, and pressure. And then your hypothalamus plays a vital role in control of body temperature, fluid balance, appetite, sleep, and certain emotions such as fear of pleasure and pain. And both the sympathetic and parasympathetic divisions of the autonomic system are under the control of the hypothalamus, as in the pituitary gland. So we see that area here, our pituitary gland. We have our hypothalamus and the thalamus. The cerebellum, it is the second largest portion of the brain. It contains 2 hemispheres with a convoluted surface, much like the cerebrum. It is mainly responsible for coordination of voluntary movement and maintenance of balance, equilibrium, and muscle tone. So it coordinates and smooths movement. And sensory messages from the semicircular canals in the inner ear send their messages to the cerebrum. So again, here's that part of the brain. So your cerebellum is responsible for your movement. Next is the brainstem. The brainstem is located at the base of the brain, and it contains the midbrain, the pons, and the medulla oblongata. These structures connect the spinal cord and the cerebrum. And the brainstem carries all the nerve fibers between the spinal cord and the cerebrum. So again, here is your brainstem. So you have your midbrain, the pons, and the medulla oblongata. It's telling you that it connects to the spinal cord, which is here, as you can see. So the midbrain, it forms the superior portion of the brainstem. It merges into the thalamus and the hypothalamus. It is responsible for motor movement, relay of impulses, and auditory and visual reflexes. It is the origin of cranial nerves 3 and 4. Then you have the pons. The pons connect to the midbrain to the medulla oblongata. The word pon means bridge. It is the origin of cranial nerves 5 through 8. And the pons is composed of myelinated nerve fibers and is responsible for sending impulses to the structures that are inferior and superior to it, so above and below it. It also contains a respiratory center that complements the respiratory center located in the medulla. So your medulla oblongata, it controls the heartbeat, rhythm of breathing, swallowing, coughing, sneezing, vomiting, and hiccups. So coverings of the brain and spinal cord. So the brain and spinal cord are surrounded by 3 protective coverings called the meninges. And that is your dura mater, your arachnoid, and the pia mater. And in the pia mater, it provides oxygen and nourishment to the nervous tissue. And these layers also bathe the spinal cord and the brain in cerebral spinal fluid. So here are the 3 layers: your dura mater, your arachnoid, and the pia mater. In the spinal cord, you have ventricles. The 4 ventricles are spaces or cavities located in the brain. You have cerebral spinal fluid, which is clear and resembles plasma. It flows into the subarachnoid spaces around the brain and the spinal cord and cushions them. It contains proteins, glucose, urea, and salt. It also contains certain substances that form a protective barrier called the blood-brain barrier that prevents harmful substances from entering the brain and the spinal cord. So your spinal cord, it has two main functions: conducting impulses to and from the brain and serving as a center for reflex actions such as knee jerking. So now let's get into the peripheral nervous system. It is made up of the motor nerves, the sensory nerves, and ganglia outside the brain and spinal cord. It is composed of 31 pairs of spinal nerves, 12 pairs of cranial nerves, and the autonomic nervous system. Your spinal nerves are named according to their corresponding vertebrae, and your cranial nerves, 11 of the pairs conduct impulses between the head, neck, and brain, with the exception of the vagus nerve, which is cranial nerve number 10. It also serves organs in the thoracic and abdominal cavities. So the peripheral system, it contains the autonomic nervous system. Its primary function is to maintain internal homeostasis, so it's going to balance things inside. For example, it tries to maintain a normal heartbeat, a constant body temperature, and a normal respiratory pattern. Your sympathetic nervous system, in times of stress, the sympathetic system takes over chip repair of the body for flight or fight. It controls the heartbeat, so it's going to make it go up. Your blood pressure is going to rise, and the adrenal glands are going to increase their secretions. And in your parasympathetic, it's going to calm the body after a crisis. So this system becomes dominant. It slows down the heartbeat. It decreases your blood pressure and the adrenal hormone output. So effects of normal aging on the nervous system. So as we age, we have loss of brain weight, loss of neurons, reduction in cerebral blood flow, decline in interconnections of dendrites, decrease in brain metabolism and oxygen use. You form senile plaques, neurofibrillary tangles, and the age pigment called lipofuscin. So now I'm going to talk about the assessment of the neurologic system. So you want to assess the patient's history for any headaches, change in visual acuity, numbness or tingling, personality changes or mood swings. You want to assess the mental status, so their orientation to person, place, time, and purpose, mood and behavior, general knowledge, and short and long-term memory. You want to assess the level of consciousness. This is the earliest and most sensitive indicator of the patient's neurologic status. So changes in LOC are a result of impaired cerebral blood flow, which derive from the cells of the cerebral cortex, and the reticular activating system, which is the RAS. So this RAS is located in the brainstem. It is a functional system essential for wakefulness, attention, concentration, and introspection. So a decreasing LOC is the earliest sign of increased intraocular pressure. And your LOC has two components, so your arousal or wakefulness, and then your awareness. So that's saying, is the patient up? Are they awake? And then you have awareness that has four components, which are orientation, memory, calculation, and fund of knowledge. So you have some terms for level of consciousness. So we have alert, disorientation, stupor, semi-comatose, and comatose. So an alert patient, they respond appropriately to auditory, tactile, and visual stimuli. Disoriented, that means they're unable to follow simple commands. Their thinking is slowed and attentive. Stupor responds to verbal commands with moaning or groaning, if at all, and they seem unaware of their surroundings. A semi-comatose patient is an impaired state of consciousness characterized by stupor, from which a patient can be aroused only by energetic stimulation. And then you have comatose, which they're unable to respond to painful stimuli. corneal and pupillary reflexes are absent. They cannot swallow or cough, and it's common that they're incontinent of urine and feces. So to help us test the level of consciousness, you have the Glasgow Coma Scale, and this scale is going to assess eye-opening, best motor response, and best verbal response. So again, it's assessing the eye, the motor, and the verbal response. So the stronger the stimulus needed to obtain a response, the lower the patient's score. The number values assigned to each part of the scale, they added to you in the objective score. So the score for a patient who is not neurologically impaired is 15. That's the highest score possible. The lowest possible score is 3. And in general, a score of 8 or less is commonly accepted as a definition of coma. You also can use the 4-score coma scale. This scale is used to assess the patient with neurological conditions that affect cognitive function, such as stroke, craniotomy, and traumatic brain injury. There are 4 categories: eye response, motor response, brainstem reflexes, and respiration pattern. And then each component is graded on a scale of 0 to 4, with 0 being the worst and 4 being the best. Then you have some terminology for language and speech. So if you want to assess your patient for aphasia, this is where they have an abnormal neurologic condition in which the language function is defective or absent, usually involving Broca's area in the frontal lobe and Wernicke's area in the posterior part of the temporal lobe. You have sensory aphasia, motor aphasia, global aphasia, and anomic aphasia. And you can take a minute to just read over that. So your sensory aphasia, this is where Wernicke's is affected. For the motor aphasia, this is the Broca's area that's affected. Your global aphasia is Broca and Wernicke's area being affected. And the anomic aphasia is a form of aphasia characterized by the inability to name objects. So your motor function, disturbances are most commonly encountered neurologic symptoms. In general, the motor status examination includes gait and stance, muscle tone coordination, involuntary movements, and muscle strength reflexes. So this is just saying that you're going to assess their ability to walk, their muscle strength, their muscle tone. In lower motor neuron dysfunction, muscles may be flaccid, which are really weak. And in upper motor neuron dysfunction, the muscles may be spastic. You also want to assess for sensory and perceptual loss. So you want to assess pain, touch, temperature, and proprioception. The sensory evaluation may reveal conditions of which the patient is unaware. An example of that is your unilateral neglect. This is where the patient is only paying attention to one side of their body. So maybe they only shave the left side of their face and they forget the whole right side. Another perceptual problem is hemianopia, which is characterized by defective vision or blindness in half of the visual field. So now I'm going to get into the laboratory and diagnostic exams. One of your major ones is the lumbar puncture. It is contraindicated in patients who might have increased ICP. It's done to obtain cerebral spinal fluid. The positioning is with the knee and head flexed at an acute angle. And afterwards, you want to make sure that the patient lies flat in bed for several hours. So here's a picture of your lumbar puncture. As you can see, the head and the knees are flexed. And they're going to insert the needle between L4 and L5. Next, you have a CT scan. You want to remember to assess for allergies to iodine or seafood if contrast medium is anticipated. And if they are going to use that, the patient may be NPO for 4 to 6 hours before the testing. You have what's called your PET scan, and this provides a non-invasive means of determining biochemical processes that occur in the blood. So you can have a total body PET scan, okay, or standard, which is just one certain area. You have your EEG. This provides evidence of focal or generalized disturbances of brain function by measuring the electrical activity of the brain. So they're going to put that on top of your head, and it's going to measure the electrical activity. Next, you have a myelogram. This is used to examine the spinal cord by observing the flow of radiopaque dye through the subarachnoid space. The most common lesion for which this test is used is a herniated or protruding intervertebral disc. Other lesions include spinal tumors, adhesions, bony deformations, and arteriovenous malformations. Headache is common, and the patient should lie flat in bed for a few hours following the procedure. Oops. So here's a picture of your myelogram. Next, you have your EMG. This measures the contraction of a muscle in response to electrical stimulation. It provides evidence of lower motor neuron disease, primary muscle disease, and defects in the transmission of electrical impulses at the neuromuscular junction, such as in myasthenia gravis. So here's a picture of that. Okay, so what did you learn? Let's review. The central nervous system is comprised of the brain and A, cranial nerves, B, spinal cord, C, peripheral nerves, or D, the spinal nerves. The answer is B, the spinal cord. The blank of a neuron carries the impulse towards the nucleus. A, cell body, B, myelin, C, axon, or D, dendrite. D, dendrite. So remember, the dendrite carries the impulse towards the cell body and the axon carries it away. Acetylcholine is decomposed by blank almost as fast as it is released. A, monoamine oxidase, B, MAO inhibitors, C, norepinephrine, or D, acetylcholinesterase. Answer is D, acetylcholinesterase. This is an enzyme found in the synapse which activates acetylcholine. The PNS is comprised of cranial nerves and A, spinal cord, B, sensory nerves, C, the brain, or D, spinal nerves. D, spinal nerves. The 31 pairs of spinal nerves and 12 pairs of cranial nerves comprise the peripheral nervous system. The cells that produce myelin in the PNS are the A, oligodendrocytes, B, axons, C, Schwann cells, or D, ependymal. The answer is C, Schwann cells. Schwann cells are glial cells that produce myelin in the PNS. The blank cells play a role in the establishment of a blood-brain chemical barrier. A, microglia, B, neuron, C, astrocyte, or D, ependymal. The answer is C, astrocyte. Astrocytes are glial cells in the CNS that are essential for the blood-brain barrier. Broca's area is located in A, the occipital lobe, B, the frontal lobe, C, the temporal lobe, or D, the parietal lobe. B, the frontal lobe. What part of the brainstem is responsible for controlling rhythm of breathing? A, the midbrain, B, dura mater, C, medulla oblongata, or D, the pons? C, the medulla oblongata. The earliest sign of increased ICP is A, pain, B, decreased level of consciousness, C, bleeding, or D, headache. The answer is B, decreased level of consciousness. The term for the level of consciousness where the patient can be aroused only by energetic stimulation is called A, disorientation, B, stupor, C, semi-comatose, or D, comatose. The answer is C, semi-comatose. The correct positioning for a patient undergoing lumbar puncture is A, prone with the knee flexed, B, dorsal recumbent with the knee flexed, C, knee and head flex at an angle, or D, Sims position with knees straight. The answer is C, knee and head flexed at an angle. So this ends part 1 of the Neuro system. Go ahead and click on part 2, which is going to get into the neural system disorders. And remember to give me a thumbs up if you find this video informative or helpful. And thank you for watching.